Okay, now let's talk about electrocardiogram. ECG, EKG, anything. Now, what do we have? Is Let's talk about conduction pathway first. Conduction pathway, or the SNO to the atria to AV node to bundle of hairs to right and left bundle branch, Purkinje fibers and ventricles. So this is all about conduction pathway. And if you want to look at a diagram, you have a SN node. It goes into the atria, the AV node. So all of the atria, right, and then goes also to the AV node. After the AV node, it goes into the bundle of his. After the bundle of his, this is bundle of his, and then it goes into right and left branch and Purkinje fiber. So right and left branch first, and then it goes into Purkinje fibers. Simple. Now left bundle branch divides into left anterior and posterior fascicles. So if you look here in this picture again, so all they're saying is this left branch divides into two fascicles. One is left anterior, and the other is left posterior fascicles. Okay. Now let's change color here. The SA node. SA node is located in the upper part of crista terminalis near the SVC opening, high yield. Where is SA node located? And let's actually read the whole SA node, and then we look at the picture. So it is the pacemaker inherit dominance with slow phase of upstroke. So here is the location, right? SA node. SA node is located where? In the crista terminalis near SVC. So this is SVC. Near the crista terminalis, we have the SA node near the superior vena cava, right? That's only one of the things that is there. Other things that they might ask you, where's the SA node? The other thing that you might have to know is it is located in the upper anterior. I'm just going to write on the left side. Upper anterior right atrium. All of them are right, okay? This is again upper anterior right atrium. Okay. At the opening of the superior vena cava. Superior or upper, they either would say superior or upper right atrium. Okay, what else? Junction of right atrium and SVC. Junction of right atrium and the SVC superior vena cava. So all of these are points which again telling you, okay, it's somewhere near the upper part of the right atrium, near the superior vena cava. So whenever they're talking about superior vena cava, you think about SA node. And what is SA node doing? It is giving a sinus rhythm. Sinus rhythm. Okay. What is AV node? Let's change the color here. AV node, on the other hand, is located in the interatrial septum near the coronary sinus opening. Blood supply usually from RCA. A 100 millisecond delay allows time for ventricular filling. So AV node is right here, and the location they said is interatrial septum near the coronary sinus opening. So let's say this is the coronary sinus near the actually they have in the book as well. This is coronary sinus. Near the coronary sinus, we have the AV node. Some other thing that they might say for the AV node is it is located at the endocardial surface. So this interatrial surface is also known as endocardial surface. Endocardial surface. It is located at the endocardial surface, which is all again interatrial septum of the right atrium, near the insertion of tricuspid septa. Near the insertion, if you look here, you have a near the insertion of tricuspid septal leaflet of the tricuspid valve. So near the insertion of leaflet of tricuspid valve. So when we are looking at either tricuspid, either coronary sinus, or the intralateral septum, which comes from the endocardial cushions, endocardial surfaces, all of that, when we talk about it, we're looking at AV node. Or they can also say coronary sinus, as I mentioned, right? So these all are things that are for the AV node. Okay, now let's look at the other thing now. What do we have here? The next thing is pacemaker rates. So SA node has a greater rate than the AV node, which has a greater rate than bundle of His. And then, excuse me, and then Purkinje and ventricles, right? So who has the maximum or the highest rate? SA node. And what rate are we looking at? We're looking at about 60 to 100 for the SA node. For AV node, we're looking at 40 to 60. For a bundle of His or Purkinje or the whole ventricle, we are looking at about 25 to 40. So the way we can look at that is 60 to 100. And then you have 40 to 60. And then you have about 20, let's just say 25 to 40. And the max is just 100, right? So that's the pacemaker rate. But pacemaker rates are different than the speed of conduction. So just think about it. The action potential is coming from here, then there's a delay here, then it goes into the Purkinje, but you see the whole thing is just simultaneously contracting. And that is due to the fact that there's a speed of conduction is different. And the speed of conduction of that action potential is highest in your Purkinjes. So it is highest here. The small ones actually here, the Purkinje fibers. It's highest in the Purkinje fibers, and then you have the highest in the atrial muscle, and then the ventricular muscle, and then the AV node, which of course you know the AV node right here, it delays. So the mnemonic here, he parks at Ventura Avenue. He parks at Ventura Avenue. So just remember, it's different. So pacemaker rates are different than the speed of conduction. And this mnemonic is a good one that you can memorize. And that's all we have for this part. And then we have the next side, which is the proper EKG. We have a P wave. In the P wave, let's talk about each one of that. So when you're reading EKG, so let's just do a proper thing. How to read a EKG. To read an EKG, first we look at the P wave, and that is right here. Zoom in. Okay, what is P wave? P wave is all about atrial depolarization. We are specifically looking at the atria getting depolarized. That's the P wave. The second thing we look at is the R. They're saying PR interval, but some extra things. Let's just talk about some extra, and then we look at the normal. The second thing we look at is your. So after looking at the P wave, okay, we have a proper P wave, and we call it, okay, we have atrial depolarization. Then we look at the We want to look at the rhythm, the heart rhythm. What is heart rhythm? So to look at a heart rhythm, we have to look at the RR interval, meaning from one R to another R. Is the interval same? Is it regular or is it irregular? Right? So in the regular, what do we mean by regular and what do we mean by irregular? So when we say regular, the distance between the RR intervals are constant, meaning there's a PQR. Okay, there's one R, meaning it's just the same constant distance. That's regular. Irregular means that it is not same. It is irregular, meaning one R is there. Let's say one R is here, the other is here, the other is just right away. So it's different, and that's the heart rhythm. Heart rhythm tells us about RR interval, in which case we call it, is it regular or irregular? Okay, after looking at that RR, I'm just gonna write RR interval. After that, what we do is we look at the QRS complex. The QRS complex is ventricular depolarization, as the P wave was atrial depolarization. We say, okay, so we have a proper QRS complex. Okay, you can't see that. Okay, we have a proper QRS complex, which tells us about ventricular depolarization. Great. P wave was about atrial depolarization, right? And that is usually less than 100 milliseconds. So less than 100 milliseconds. After this point, what we look at is the fourth point, which is two things. We look at the PR and the QT intervals. So these two things. PR interval and the QT interval. So we are looking at, what do we look at in the PR? Or what is PR? It is the time from the start of atrial depolarization to the start of ventricular depolarization, right here. So if you, let me erase all this. So this is the PR, right? PR interval is the time that the atrial depolarization starts till the time the ventricular depolarization starts. It's called PR interval. It's all about atrial depolarization. Excuse me. Then you have the QT interval. What is QT? If you look at QT now, this is QT. It talks about how, this is QT. Let's see what they're saying. The ventricular, so a couple of things in the QT, right? So ventricular depolarization, yeah, ventricular depolarization is here in the QT. Mechanical contraction of the ventricles, yeah, in depolarization literally means that you're contracting ventricles, great. And ventricular repolarization and ventricular repolarization. This is the QT. So there are two intervals. One is the PR. It only talks about atrial depolarization, and what is QT, from Q all the way to the end of T. That tells us about ventricular depolarization and then again repolarization, because atrial depolarization is masked behind this, so we can't really have an atrial repolarization interval because it is masked. Okay, now let's look at the T wave. What is the, now this was the fourth point, right? Yes, fourth point. Then the fifth point is we look for the T wave. Let's see, read that and then look at the T wave. So what is the T wave? It's a ventricular repolarization. T wave inversion may indicate ischemia, recent MI. Simple. T wave is specific for ventricular repolarization. If I ask you, okay, what is specific for atrial depolarization, you will say P wave. If I say specifically, what is specific for ventricular depolarization, you will say QRS. Right here, QRS complex. If I say specifically, what is specific for ventricular repolarization, you will say T wave. It's a bunch of facts that you have to memorize, and that's what we have here. So after the T wave, we have the J point. What is J point? So first, understanding is one thing that you're doing right now, but then again, you need memorization of this, all these uh, uh, simple things that I just told you. Okay. And what is J point? J point is the junction between the end of QRS complex and the start of ST segment. So end of QRS complex and the start of ST segment is the J point. Not that important, but okay, good to know. But then we have this ST segment. What is ST segment? This one right here. ST segment is isoelectric, ventricle depolarized. Isoelectric means there is no voltage that is coming in or there is no voltage that is going out. Okay, one more important thing is this is the EKG. So any positive current will give you a deflection on the curve. Either it's going to be a positive deflection or it's going to be a negative deflection. What is a positive deflection? Meaning the current is, if it's going towards positivity, it's going to cause the graph to go up. But if it is going in negativity, it will cause negative deflection, which is going the curve will go down instead of going up. That's one thing. Isoelectric. It means there is no charge. There is no current that is going in or out. It's isoelectric. It is there is no charge here. It's just there is no inward or outward charge going. It's isoelectric. Okay, kind of sort of relaxed sort of a state. So ST segment is isoelectric as here, and here we have ventricular depolarized. Ventricular has fully depolarized, and we already know. Okay, if you look here, ventricular has depolarized here, and that is why no charge is going here because it is depolarized. Okay, then you have the last one, which is called U wave. What is U wave? U wave, we are looking at the prominent in the hypokalemia. Think hypokalemia or bradycardia. And U wave is right here. So the mnemonic is hypokalemia. And for hypokalemia, you're going to say hypo, U is for O. Okay, so hypokalemia. That is there. Okay, so that's what we have when we look at all of this. But sometimes you don't have, if you want to read an EKG properly, so let's just also take a look at that quickly. So to read an EKG, we have a big box and a small box. So let's just do a big box here. This is one big box, right? And let's also mention one small box. So one big box it equals 200 milliseconds. Okay, and one small box, which is here, it will equal 40 milliseconds. Okay, so then you can calculate how, if we have the QT prolongation, Q to T has it prolonged just by looking at the boxes. And 200 milliseconds, in other words, as mentioned here, is only 2.2 seconds. Okay, so you can read it this way. That's one of the things. What else you can have? Let's say somebody has given you an EKG and you want to read that. How do you read this? So first of all, you would locate. The first thing you do is you would determine the heart rate on an EKG. How do you determine the heart rate on EKG? To determine the heart rate on EKG, what you do is you locate the R which falls. Let's say this is a big box, one big box, right? So locate the R which falls on or near one of the line of the big box. Okay, that's one thing. Locate the R that it falls on the or the whole QRS complex, which falls on the near or the big big box line. That's one thing. Then locate the locate the QRS complex near or on the big box line, and count till the next QRS that falls on the big box line. For example, from here, so you have a P, Q, R, F, and then your T, and then you have this one P, P, Q, R, S, T, and then let's say this one is gonna want P, Q, R, S, T. So this one is falling on the big box line. This one also falling on the big box line. So what we do is, this QRS complex is falling on the big box line or near the big box line. We calculate. How do we calculate? Okay, let's say this is the starting point that we had, right? So the starting point, after the start point, we will say, okay, the next line, whatever it falls on, whatever the QRS complex is, um, or whatever the next big line is right here, this is going to be our 300 heart rate. The next line we have of the big box line is going to be 150 heart rate. So right now, if this is a real patient, this falls on this QRS complex falls on this one of the big line, and this one is also falling on one of the big lines, one of the big box line, right? So this patient would have 150 heart rate, and this way you go just down and down until you again have a QRS complex which falls on the QRS. So if it doesn't fall on 150, then you go and look at the next big box line. That will give you 100 heart rate. And after that you have another one which would give you 75 heart rate. And after 75 you're looking at another big box line that would give you 60, and then you have another one which will give you 50. So it goes on and on. All you're trying to see is if the QRS complex falls on the big line or near the big line, very close to the big line, big box line, and where else that QRS falls on that same big box line, and wherever it falls, you just call that the heart rate. Okay. So that is what you have. On top of this, this is how you read the heart rate through just the EKG. What else we might have? If you don't see a P wave, yeah, this is important. If you don't see a P wave, there is no P wave, let's say. If there is no P wave, and there is a regular rhythm, and again, what was rhythm? Rhythm was R to R point. Is it equal or not equal? If it is regular means it's equal. Then what you're looking at is the supraventricular tachycardias, ventricular tachycardias. But if you have a P wave and you have you have a regular rhythm, then this is called a sinus rhythm. Sinus rhythm. If you have the next thing is if you have no P wave, plus you have irregular RR interval, that is seen in your AFib, which is known as irregular rate and rhythm. Okay, so that's there. Now the next thing is about if you have if you have a P wave but you have irregular RR interval. If you have a P wave but you have irregular rhythm, you will call, because you have a P wave, we'll call it a sinus rhythm with multifocal atrial tachycardia. So again, the whole summary was all about if you don't see a P wave, but you have a regular rhythm. Okay, let's just talk about first normal. What is normal? If you have a P wave, yes. You have a regular RR rhythm, yes. You call it sinus rhythm. Simple. No P wave, regular RR rhythm, that is SVTs, supraventricular tachycardias. That's one thing. Second thing is all about if you don't have a P wave, if you have a P wave, yes, and you have irregular RR, then you call it AFib, irregular rate and rhythm. But if in the same way, again, you my bad, you didn't have a P wave for AFib. But if you do have a P wave and you have a irregular rhythm, that is going to be seen in your multifocal atrial tachycardia with sinus rhythm. Okay, this was just a little extra, but not not that of important. But you will see that in the next high yield points. Okay, let's quickly review this page. High yield points. Okay, what do we have in the high yield? Location, and location of the SA node, AV node. Whenever you think about SA node, think about SVC, superior vena cava. AV node, think about the tricuspid valve, coronary sinus, near the tricuspid leaflet, interatrial septum, which is also known as endocardial septum. Okay, pacemaker rates, you know, SA and AV nodes are way higher than anything else, but speed of conduction is another way to it's like thinking about you. We normally don't think speed of conduction is the his Purkinje has the maximum speed of conduction, and then the atria, then the ventricle. For all of the to read the ECG or to see the ECG, we have to look at the P wave. P wave is right here. Is all about atrial. So P wave is about atrial depolarization, while QRS complex is all about depolarization. T wave is about repolarization of the atria. Now the intervals, PR interval is all about again atrial depolarization. QT interval is ventricular depolarization and then ventricular repolarization. And yes, that's all for electrocardiogram.